Hi YouTube, it's Lisa coming at you. It is February, what is it already? 23rd, it's Saturday. Wednesday, the 20th, I had my pre-endoscopy. My surgeon does that before your surgery, usually a couple weeks out before, to make sure he sees what he's getting into, so there's no surprises when he has surgery that day. So I went, for the outpatient, and it was it was so funny. The lady in the room said to me, "You're like the most calmest person." I said to her, "Oh," I was cracking jokes and things like that, and I said to her, "Oh, don't ask me that come surgery day. I think I'm going to be a mess." So my surgeon came in after the procedure and he said the stomach looked great. There were no issues or redness or GERD or acid reflux or anything like that. And he said to me, "Well, the next time I'll be seeing you is March 18th. So, he said it must be a lucky day because there was someone there in another room that was having surgery that day as well. So, as much as I came across as so cool, calm, and confident, I have not been, lately, from some of in my last video, upper respiratory issues that I had, has left me not feeling so great, and like I've been having this pain on my left side, and I don't know if it's my kidney stone that's in there acting up, and my mind just focuses on it continuously. So, and I keep thinking something's going to stop the surgery again, which is totally insane, and maybe it's normal. I don't know, maybe this is a normal feeling that other people have had, that you're getting apprehensive that the weeks are just ticking down. Next Sunday, I'm going to be starting my pre-op diet, and so that's 2 weeks before my surgery. So when I saw my doctor today, he is sending me to go get an ultrasound done next week, just to make sure that the kidney stone didn't move somewhere where it shouldn't have, and then also just looking at upper left quadrant of my abdomen, just to make sure that the spleen isn't swollen or anything like that from the upper respiratory infections that I've had. He's confident that there's nothing really going on, and quite honestly, he prescribed me 20 pills till surgery of a light 1 milligram dose of Xanax to kind of get me through. And he just said, "I think you're psyching yourself out, and I think you're looking into things too much right now, and I think you need a break." Work, I work for an insurance company, and it's our busiest time of year. We're in what they call peak season. We're going to be coming out of it, so I've been stressed with that, and daily life. I have 2 kids, 2 little kids. My husband, we'll count him as a child as well. So, it's just life. It's crazy. And I just keep, on top of this, the last 3 days, get this, I've run into 3 different people that I had mentioned to that I was having bariatric surgery. And 3 of those people knew 3 different people who had 3 different issues that were complications. So, of course, he didn't want to tell me, but since I could sense that, their story that they had wasn't great, I kind of picked at them until they told me, and it was just 3 stories of 3 different complications, and it kind of was a downer, because the reality is things could happen, and I know that. That's what all the classes were for. That's what all these YouTube videos that I watched were for. And I kind of got down, when I got home yesterday and I heard the 3rd, bad story, I just was like, I just broke down and started crying, thinking, is this the right thing to do? And then laying there, it's like I had this aha, like Oprah would say, moment, thinking, what about all the videos that you watch that people had success stories and had great outcomes and didn't have complications and didn't have problems? Yeah, there's unfortunate things that could happen. Absolutely. But then on the other hand, look at all the people that it's helped, and they've had tremendous outcomes from the surgery. And didn't have all the complications. So I had to really put that into perspective. And really the next month, I'm just going to try focus on getting my mind ready for this. You know, getting into the thought process that this is going to change my life forever. And if there's little bumps in the road, I need to get through them. You know, normally, always, I've been a strong person, and lately I don't feel that way anymore. And, you know, that's one of the reasons I'm having this. So, you know, kudos to all those people who've everything worked out great. And, you know, for people that it didn't work out so great, I'm sorry. It's just that, you know, I'm going to have to focus right now on myself, and I know the time's dwindling, so I got to do it. And, you know, be able to realize that I can, you know, be able to overcome anything that can come up. So, good thoughts. You know, I'm going to get myself together. I can't keep thinking about things that could go wrong or not feeling great and things like that. You know, it happens to everyone, and it's your 40s. Hello, people. It's not like I'm Mrs. Healthy anymore. There's things that come up, and it's just called age. So I want to say thanks for the new subscribers that I got. You know, I'm not that great at all this computer stuff, so I'm like, geez, how do all these people get people that watch them? Is there some kind of secret, or am I just that lame? Well, I guess I'll be making another video, and who knows, maybe now they're going to be weekly videos, and it will probably be like chicken soup for the soul for me, and hopefully this could help calm someone else. So thanks, YouTube. Have a great weekend.